First of all, I would like to thank you, the organizer of the Congress. It's really a pleasure to be here today. And it's also the good opportunity to try to translate in clinical practice your research. Just a few words concerning the European Medical Association and the European Association for Predictive, Preventive and Personalized Medicine. Is something not a trade union, and we are aiming to all doctors in EU now confronted with a new concept in European healthcare. This is something very important. We are free from any political, linguistical, ethical, philosophical or financial considerations, and our philosophy is the better informed doctors make better treated patients. This is important. This is very essential for us to pass the information to our colleagues. What is now the philosophy from less effective? What is less effective? Less effective, it means, is clinical science, symptoms, medical and family story, laboratory, imaging, diagnostic, and of course the treatment. This is the normal way, everybody knows this one. What we propose? We propose to go a little bit far on this. This is the approach to treatment after the signs and the symptoms appear. This is the actual situation. We have to wait until something is evident and after we start. But it's not exactly what we want. Which kind of physician do we want for the next century? We need to use the new technologies. We need to use the laboratory, the biomarkers, biobanking, laboratory medicine. We must have a very clear idea of the tomorrow doctors. This is the paradigm. What we want is really to attain the point T, is a theoretical point between efficiency and equity. Because this is an important aspect. In our daily activity, we must be efficient, but also we must consider the equity. Today in Europe, we don't have the same access to the healthcare, and we have a big gap amongst our countries. The new philosophy, the predictive medicine, is exactly, we need to start before the symptoms appear. This is our goal. This is what we would like to do. And personalized medicine, are we ready? This is a big problem. We need to consider the healthcare in Europe. We don't have an European healthcare system. We have the different healthcare system with different problems and especially with enormous financial problems. Not everybody has access the same way in Europe. The pharmaceutical industry, historically the pharmaceutical industry has developed medication based on empirical observation and more recently no disease mechanism. For example, the antibiotics were based on the observation that the microbe produce substances that inhibit other species. And this with antibiotics, the same way the antihypertensive is the same for the cholesterol, the same for diabetes. What is now the problem? The pharmaceutical industry produce a certain kind of products. The patients with the same diagnostic receive the same prescription, but we have the patients where the drugs are toxic and not beneficial. It's a normal observation. We have the another group with the drugs not toxic and beneficial. The third group, drug not toxic and not beneficial. And also the last one, drugs are toxic but beneficial. This is the situation. What we try to do, to select the patients where only the drugs are not toxic and beneficial. It's not easy, it's not simple, and we need really the support of the research, and we need the support of the pharmaceutical industry. In 10 minutes, it's very difficult to explain all problems with personalized medicine, but we try just to give some ideas. Today, many medicines do not work effectively for a large number of the patients they are supposed to treat. Personalized medicine aims to improve this situation by providing the right diagnosis. And finally, the personalized medicine definition must be the right dose, the right patients, in the right time. This is not only something and only the idea. The personalized medicine is certainly the future. And this is what we need: the diagnostic test positive. We need to know in advance the patient's profile. We need to know in advance all the reaction of the patients. And the diagnostic test negative, we don't use because we lose the money and we don't help the patients. It's just the idea. The really long-term, but probably it's middle-term future, is this one, where one pills with our name, where it's possible to treat our pathologies. And a lot of laboratories try to use this one, but it's impossible to use the same dose, the same medication for everybody. This is what we expect. It's not really simple for the clinicians, every day confronted with the patients. We need to spend more time and more energy to know more and better our patients. We need more tests, and especially we need to prepare the patient profile as soon as possible. We don't need to wait when the pathology are evident. The personalized medicine in Europe is not new. The European Commission spent a lot of money in this field. The European Commission organized different congresses, different meetings, different workshops. We have one unit specialized in personalized medicine, and it's really the good opportunity for all of us to participate, to give your advice, to create the network, to create the consortia. For the next framework program is planned the very important amount specific for the personalized medicine. This is one of the projects, the PREDICT project. It was launched 2 years ago, and now is finished. The predicting drug effect on the heart is one of the aspects. It's not also in this case available for everybody, but it's the first step. What we want, what is really our suggestion as association, as a group, after discussion? The preventive, predictive, personalized medicine. First step is certainly the educational program for population. We need to inform the patients. We need to inform the doctors and all healthcare professionals with specialized educational programs. This is one step. Second one, we need a budget, special budget dedicated for implementation at national, international, and probably global level. Another aspect is the knowledge transfer. is not always simple. We need to talk, we need to share our information, we need to put together our resources. And especially in this case, publication, standardization, patenting, license. And also the industrial production. We need the innovative technology. We would like to invite the industry to produce more, to dedicate more energy in this field. And also, another aspect are the insurance. Right now, the insurance play a more and more important role in the healthcare system. We need to involve the insurance with legislation in terms to protect the patients. It's easy with some tests to say, okay, this patient is the high-risk patients, I don't cover this risk. No, we need the legislation, but we need to involve the insurance. And also, we need more center, the specialized center, the medical practice, the specialized laboratory. Now we are planned to open in Brussels for the next September the first center dedicated to the preventive, predictive, and personalized medicine. It's the new experience. It's like the checkup center, but with more interest in patient's profile. We need really the idea, we need to support. We are ready to test the new biomarkers, the new laboratory, because this is the future. We need to go in this direction. And also for this, we need the doctor prepared, we need the healthcare professional prepared. It's not only the laboratory, we need also to involve the preventive measure and personalized patient's treatment. And also we need the ethics. This is a very important aspect. We don't talk about the ethics very frequently, but it's important because something changed and the ethics aspects are more and more important. This is the complete schema, very difficult, and this is what the last conference organized by the Commission on European perspective in personalized medicine. We have a lot of opportunities. The European Commission gives a lot of money for this, but we need the new idea, we need the new project, we need the new support, the new network. The personalized medicine is a good opportunity, also for all countries not yet at very high level of healthcare. We need to offer this opportunity to everybody, but especially, and this is my objective here today, the important is to transfer in the clinical practice the research. We need to find the link between the research and clinical practice. I think, and this is important, just in our association, we publish the journal, is 4 issues right now. We organize this, we are preparing this new book in healthcare in Europe, in a perspective. If you have something to propose, you are very, very welcome. And also, we organize this first World Congress in next September, between 15 to 18 September 2011 in Bonn. The EPMA Congress will be the good opportunity for everybody to stay together and to discuss. What I would like to stress, the key points are standardization of medical approach, education in the complementary field, implementation of advanced predictive, preventive, and personalized medicine-related technology, and especially appropriate financial program by government and institutions. I think, and I try to stay only 10 minutes as planned. I would like to thank you, all of you, for your attention. And with this consideration, the personalized medicine is not a solo concert. It's really the orchestra concert. And the orchestra is very good if everybody play correctly its role. Now we have the opportunity to play our role in this big concert, in this new opera we would like to prepare. The title is The Personalized Medicine. Thank you very much for your attention.